Every 5 seconds, someone somewhere develops diabetes. Every 10 seconds, someone dies of it. The illness is exploding at staggering rates, and perhaps nowhere more so than in the Gulf region. But one nation there is taking action and finding creative ways to stop the problem before it's too late. We travel now to Qatar. It's one of the wealthiest countries in the world, the oil-rich Gulf state of Qatar. Wealth is visible everywhere here, from high-end automobiles to a booming construction industry. The nation's bounty of riches has all but transformed the lives of many, from a nomadic lifestyle to one of luxury and leisure. But this shift in lifestyle here has come at a significant price, one that's affecting the health of its population and putting an entire nation at risk.
Before, I used to go normally in the car without any problems, but now I have to use a wheelchair.
Abdul Razak is just one of hundreds of thousands of people in Qatar diagnosed with diabetes, an illness in which there are high levels of sugar in the blood. Known as the silent killer, a staggering 20% of the nation's population is afflicted, the fourth highest rate in the world.
Diabetes is exploding.
Dr. Gojka Roglic at the World Health Organization, or WHO.
Every population is showing an increase. In fact, it's a growing problem in every country in the world.
According to the WHO, nearly 350 million people worldwide, almost 5% of the world's population, are living with the disease. It's estimated that this number could double within the next 20 years.
It is a nasty disease. It destroys your body from inside, without you even knowing it.
While some cases of diabetes are hereditary, experts blame the staggering global rise of the illness on more sedentary lifestyles and skyrocketing obesity rates. Especially hard hit is the Gulf region. Fast food chains now dot the landscape across the region.
I like the junk food, burger.
Manal Musalam is a doctor at Qatar's largest medical institution, Hamad Medical Corporation.
People, they are storing fats more and they are not exercising. We're worried about the kids.
Some 40% of all Qatari school children are obese. And it's predicted that nearly 3/4 of adults here will be obese within the next 5 years, dramatically increasing their risk of developing the disease.
If the family not having diabetic patient from the family member, the housemates or the driver, he's having diabetes. So they're becoming afraid.
In many cases, with good management, including insulin and oral medications, patients can live with the disease. But for others, diabetes has devastating consequences. The illness has already claimed the lives of more than half of Abdul Razak's family.
My father was diabetic. He passed away. My brother, the same thing. And for my mother, she had diabetes for a long time and passed away about a week ago.
Abdul Razak says he first suspected he was diabetic when he was only 25 years old.
I was tired and not feeling well, so I went to check my sugar level and discovered it was very high.
Once a talented athlete, at 52, Abdul Razak is now confined to his home, leaving only to go to the hospital for frequent medical checkups and treatment. He's also relegated to a lifetime of prescription medications, injections and constant monitoring of his blood sugar levels. But despite his compliance, Abdul Razak's disease is quickly intensifying. Diabetes is claiming different parts of his body, one at a time.
I had an operation on my right leg. They cut off one of my toes, and some of my bones were broken in the process.
The disease then struck his eyesight, a common consequence of diabetes.
I cannot see in my left eye.
With his kidneys now failing, Abdul Razak travels to the hospital 3 times a week for dialysis. Without this treatment, which removes toxins from the blood, he could fall into a coma. But Abdul Razak knows that the toll is more than just physical. Diabetes has taken an enormous emotional toll on his family, especially his daughter Fatima.
It's something difficult for the whole family. He gets tired, he cannot move. I wish that he could be healthy like before. I cannot accept that my father is so weak.
Also unable to accept this reality is Abdul Razak's friend Hassan, who is diabetic as well. Hassan now eats well and exercises daily. Difficult in a place so hot and humid, and where riding in air-conditioned cars has all but replaced riding on camels.
As long as I am taking care of my food intake and my exercise, and I exercise daily, all of these things will help.
In a groundbreaking response to the rapid spread of diabetes in the country, the Qatari government is leading the way, taking inventive measures to stop the epidemic, allocating nearly 20% of the nation's entire health budget to treatment and prevention. It's providing testing equipment to patients like Hassan and Abdul Razak free of charge. It's ordered fast food eateries throughout the nation to list the calorie count in every meal. And in a move to prevent future cases and to help children currently living with the disease, the government has done something extraordinary. It's offering free summer camps to every single child living in Qatar. There, the children are taught about diabetes and are encouraged to exercise and eat well. The nation is also looking to bring the latest, most advanced technology to its fight against diabetes. Qatar's medical center is now at the forefront of cutting-edge research in the field, collaborating with major universities abroad to predict early on a patient's risk of developing this and other diseases, all through genetic analysis. While all this may bring hope for the future, for now, Abdul Razak is on the waiting list for a kidney transplant. Without this operation, his chances of survival remain slim.
When I got diabetes, I wasn't paying much attention to it. What's diabetes? My advice is that whoever gets the disease must pay attention to it from the beginning.
Something this nation is doing with the hope of securing a healthier future for generations to come.